All right, guys. So I want to talk about an important topic regarding MRIs. And this is a question that I've seen a lot of patients get burnt by, and a route that a lot of them wish they would have avoided and would have known more information about before going down that road. So a lot of times when people are dealing with an injury, they're looking for answers. They want to know what's going on, what the exact injury is, why it happened, and yeah, just have answers about what's going on with their injury. And so a lot of people, the first thing that they turn to is an MRI. So they go and see their physician. The physician says, "Okay, let's do an X-ray." And then what happens is it leads to an MRI more times often than not. And the reason for that is because an X-ray isn't going to show any tendon or ligaments or muscular issues. It's strictly going to reveal skeletal abnormalities such as fractures. That's it. And a lot of times there isn't a fracture. And so whenever there's not a fracture, that then they move on to ordering an MRI so they can start picking up on any other abnormalities that might be going on, such as like with ligaments, tendons, or the muscles. And the problem, and I want to go over the problem with that today, because you aren't, the bottom line that I want you guys to take away from today is that you are not your MRI. You're not what shows up on an MRI. What do I mean by that? So this is percentages based on some research that was done. So in patients or people that are asymptomatic, aka people not having pain, they did an MRI on people that weren't having pain and to see what would show up on an MRI. And they found out that people aged from 20 to 70, there was a disc bulge in 87% of those people of the neck or somewhere along the spine. Again, these people were not having pain, but still 87% of people had a disc bulge. So big thing takeaway from here is just because something shows up on an MRI or does not show up on an MRI, there's not a huge correlation to pain and issues with that. All right. So another thing they took with regards to the shoulder, they looked at the shoulder, and 22% of people that weren't having any pain in their shoulder had a rotator cuff tear. Then there, and 78% there was bursal thickening. And then just overall abnormalities in general, 96% of people aged 40 to 70 had something that showed up on MRI, even though they weren't having pain. Okay. So you can imagine if you go in, you have, if you go in, you get an MRI done for shoulder pain, something's most likely going to come up. I mean, it's a 4% chance that nothing does. So it doesn't, big thing is just because something shows up doesn't mean that there's going to be X amount of pain or it's the cause of the pain that you're experiencing. Okay. So this goes along, these other percentages along here, just like on different, kind of just repeating the same information on different areas of the body. Okay. Just pretty much essentially telling you that in asymptomatic people, most likely there's something that will show up on an MRI. Okay. So the problem with that, I want to kind of talk about another research study just to drive this point home, is they did an MRI for people that were having unilateral shoulder pain, meaning that they had pain on one shoulder and weren't having pain on the other. And they went in and did an MRI on both shoulders. The painful shoulder had 92%, about 93% showed up with the rotator cuff tendinopathy. Non-painful shoulder showed up almost 89% that there was something going on there. So there is some MRIs can be beneficial, don't get me wrong, but the fact is that us Americans tend to read into MRIs too much, okay, and take it for verbatim and just ride with it. And so there you can see there's a correlation, but I mean, it's just a 4% difference. Same thing for labral issues. That's just another type of injury. I don't want to get too in depth with anatomy and stuff, but that's just another type of shoulder injury. AC joint pathology is just another injury of the shoulder, and it's really just ranges between 4 to 8%. Okay, so sorry, 2 to 4%. And you know, the thing about MRIs too is, just like I like to use the analogy with my patients, that if you, as we get older, we just naturally have, we develop wrinkles over time. Same thing that's happening outside of our body with wrinkles in our skin, it's happening, the same thing's happening on the inside of our body too. It doesn't just stay pristine. It's part of the natural aging process for these things to show up on MRI, all right, or MRI or X-ray, usually MRIs, but it's just a natural part of the aging process. Okay, so that's kind of the sense of how inaccurate or unreliable MRIs actually are. Okay. So now I want to kind of turn it into like healthcare cost issue as well. So as Americans, we get 42% more MRIs per capita than people in similar countries. An MRI in the US is also 2.2 times the cost of an MRI in similar countries. Okay. So you can see that there is just an overutilization of MRIs. Okay. And this leads to increased healthcare spending as well, which we have a problem in the US. We spend so much on healthcare, and our life expectancy is so much less than people, other countries that are spending, our life expectancy is lower than people that are spending even less than the fraction of healthcare spending. Okay. And so for orthopedic conditions, an early MRI is also linked to increased rates of opioid prescription, injections, and surgery. And the reason for that is once the surgeon or somebody or your physician or somebody sees something on an MRI, they just run with it and be like, oh, this is 100% the cause of your pain. This isn't normal. We need to be doing something. We need to be taking care of this, opioid injections or surgery. Okay, sometimes they'll recommend PT. Don't get me wrong. Sometimes they will recommend PT. But you'll see in these next slides that people that just turn to an MRI before conservative approaches with PT to get relief, they have a significant increase in opioid prescription addiction, injections, and surgery. And on top of that, healthcare spending. Okay, so want to kind of talk about the costs. So multiple guidelines, this is per study, multiple guidelines agree that imaging should be avoided, especially within 30 days of diagnosis or without exhaustive conservative options like physical therapy first. Okay, a 2019 study of 2.5 million patients with new back pain, okay, among non-surgically treated patients, which were about 99% of the total patients, only 13.6 received physical therapy first. But let's look at their cost. The cost was they only spent $509, okay, through that. The people that didn't get PT first, there was 32.3% had imaging within 30 days of a diagnosis, and then also 35.3 had imaging without or before PT. The cost of care with this was over double. Okay, so adherence to these guidelines reduces the likelihood of surgical intervention and lowers healthcare spending, aka keeping more money in your pocket to allocate to other things. Okay, things that are actually going to help make progress. Like when you get an MRI, that doesn't treat anything. That just gives you a piece of the puzzle. Okay, but if you get an MRI first and then get PT afterwards, more often than not, the MRI was more expensive than the actual PT. And you really didn't get a whole lot of answers because, like we saw earlier, something was bound to, even if you weren't having pain, something was probably going to show up on an MRI either way, right? So I want to kind of go back to, we talked about surgery, injections, and all that too. So I want to look at the prevalence of how, if you get an MRI first, you can see that you're almost three times as likely to get surgery than if you went and got PT first. Okay. For injections, you're about 2.5 times more likely to get an injection if you get MRI versus PT first. Same thing with spine surgery, seeing a spine surgeon, seeing a spine specialist, ER visits. Those all increase if you get an MRI. And that's because people are overreacting, including your physician and other professionals. They're overreacting to what's showing up on an MRI and just leaving it as an end all be all. Okay. There's a lot more that goes into the human body than what shows up on an MRI. Okay. Patients who had an MRI first spent on average almost $5,000 more in associated healthcare costs than those who had PT first. Okay. So why is that? Why is it so much cheaper to see a physical therapist first than go get an MRI? So there's two answers for this. One is the normal, and this is what I hope that the healthcare system starts changing a little bit, is the normal course of action is to see your physician. If you're having pain, you go see your physician, right? They do maybe spend 5-10 minutes with you, maybe do 1 or 2 tests, and they're like, oh, well, you don't know enough information. Let's get some imaging. So what happens is now you paid for your physician visit. Now you have to get an X-ray because that's what they'll order because they don't know enough information based on the 5 or 10 minutes they spent with you. No surprise. So they order an X-ray. And again, X-rays are only going to show up skeletal abnormalities. Most of the time, they need more information, unless a fracture does show up on an X-ray, but usually that doesn't happen. And then the third step is they will order an MRI to get more information about tendons, ligaments, and muscular system. All right. And MRIs aren't cheap. Okay. I think they well over $1,000. Okay. And you're better off putting that money towards actually getting that fixed. But anyways, now you got the cost of your physician. going to see your physician and the time. Now you probably have to schedule another visit to set up a time to get an x-ray. Okay, waiting room, who knows how long you wait, and get an x-ray, wait for the results to get back. Then you go in maybe a week later, get an MRI. It's expensive, time wasted again to go in and get an MRI, and then costs associated with that. And then they read the MRI and then they tell you, okay, this is what we found on an MRI. Now you have to do either, you've got options. This is the thing, is when you go see your physician, they only have 4 options. Okay, especially also when you get done with your MRI, they can say injections. Do you want to do injections, medications, surgery, or PT? Okay, I don't know about you, but I'm going to take the PT every time. No, I don't want to be take the risk of getting addicted to opioids. I don't want injections. I don't want surgery. Don't want medications. So what's left is physical therapy. If you know right off the bat that you don't want to do injections, medications, or surgery, you're better off just skipping all the bull crap and just going to see a physical therapist in the first place. And a lot of people don't know this too. In the U.S., most U.S. states, this California included, and Iowa and all that, I think there's only maybe 1 or 2 states that don't have direct access, but we have direct access in most of the states. Okay, what that means is you can see a physical therapist without needing a referral, without needing to see your physician or anything like that. So if you know you don't want to do injections, medications, or surgery, you might as well just skip to PT and start getting answers and start making progress. Not only does it take a lot of money and energy to see your physician, get an x-ray, get an MRI, and then maybe try injections and then see PT. That's a long process. That's going to take weeks to do and you start getting some answers. And over that time, that's time that you could have been using to treat your issue and seeing a physical therapist. Okay, but now instead of going all that down that route and you decide you want to do physical therapy because you want to avoid injections, medications, and surgery, now we're 3 or 4 weeks behind. That means that the injury is most likely worse, and now the recovery time is going to take even longer than if you would have just seen a physical therapist in the first place. Okay, so that's why the healthcare costs are so much higher, or so astronomically higher if you go see your physician, x-ray, MRI, injections, surgery, medications, all that, than if you just went to see a PT first. Okay, so I wonder what I could have bought if I didn't have to spend $2,600 on MRI. That would literally pay for your entire treatment and then some to get physical therapy done and corrected and get this whole issue solved, right? So another thing too is an MRI doesn't tell us a whole lot. So in a sense, like, don't get me wrong, there's room for and a time and place for MRIs. A lot of times, not a lot of times, but there's a handful of times where patients will have gotten an MRI and had the results and bring that in to see us. And do we take that into account when we're trying to figure out what's going on and the plan of care and the route going forward? Absolutely. However, when somebody has those results from MRI, that's really only maybe a very small piece of the puzzle. I put a percentage base on the weight that holds is maybe 5 to 10% overall. The reason for that is because our assessments that we do as physical therapists, we can do orthopedic assessments, see how you move, see how strong you are, and see your range of motion, see what you're struggling with, what your goals are, and that tells us a hell of a lot more than what shows up on an MRI. Because at the end of the day, as you guys saw, even if somebody wasn't having pain, something probably would have showed up on an MRI anyways. Okay, so again, we can tell a hell of a lot more just by seeing you move and testing your strength, range of motion, and seeing what you're having pain with, what doesn't hurt, and modifying things that way. So that's my whole spiel on the benefits of MRI versus PT and all that too. So this is just another graphic kind of explaining what I talked about before is somebody sustains an orthopedic injury, they see their primary care. So if you see it on the right side, you see a primary care physician, orthopedic surgeon. This is usually for like back pain. They see an orthopedic surgeon, they get imaging done, and they say, oh, we need to do surgery. Okay. And a lot of times people are funny. They think that, oh, I'll just get surgery and then I'll be done. I'll be fixed. No, you need to do physical therapy. You probably need to do more physical therapy after surgery than you would have if you just tried PT in the first place and had a chance to avoid, surgery. Surgery is dangerous, especially for the spine. Personally, I don't want somebody digging in my back. There's so many nerves and you got your spinal cord there. As a physical therapist and the other 2 physical therapists on the team will back me on this. we've seen some pretty nasty things and results from surgery. And a lot of times when we talk to these patients, they didn't try PT first. And they're like, oh my gosh, this is a big regret of mine. I wish I would have just done PT first and at least gave myself a chance to avoid this. And that's what I really want to drive home is that surgery isn't going to fix you. You're still going to need to do PT, even more PT than you would have if you would just saw PT first before even think about surgery. Okay, and at least give yourself a chance to not need the surgery. Okay, versus if you, it's the same, the opposite side of this is you get an orthopedic injury, you see a physical therapist, skip all that, and at least give yourself a chance. Okay, to avoid having to go see your physician, get expensive imaging, put yourself at risk for having to do injections, medications, or surgery. Okay, so that's my big spiel on that. So what I guess the question that you guys might be asking, like, well, what should I do instead? Somebody's kind of just like what I mentioned before is if you have been dealing with an injury, get it looked at by a physical therapist, chiropractic care, somebody that isn't going to, especially if you see somebody and they maybe spend 5 to 10 minutes with you and they jump to prescribing opioids, medications, injections, or surgery without recommending any conservative care, run far away. Go get a second opinion until you find somebody that is going to take a less invasive approach and actually give you a chance to get healthy without having to do these invasive procedures and whatnot. So if you have an orthopedic injury, go get it looked at. A physical therapist, the right physical therapist. Don't get me wrong. There's not. I don't want you want to use the blanket statement for physical therapy because there's such a wide range of physical therapy. If you have an injury, search physical therapy near you, and then read the reviews. Okay, read the reviews and look for stories similar to what you're dealing with, and seeing what other people got results with. Did they have good results? Do they have good things to say, bad things to say? And then determine what route or what physical therapist you want to see, because some physical therapists are obviously going to put you in a better position to be successful than others. Okay, so look at their track record, look at their reviews. Okay, it says a lot. That's what I would do as a patient. If I was having pain, I would look at reviews and looking who has the most reviews and the best overall reviews, and then look at their website. Does the words on their website resonate with you? You know, so example, if you hop on our website, it states right when you enter, we help active adults and athletes in Oakland and the surrounding Bay Area get back to workouts and sports that they enjoy. Okay, that sounds like we're probably a pretty good fit. Okay, because that's what we specialize in helping. Okay, so what should you do instead? Go see a physical therapist. Make sure you're spending one-on-one time with the physical therapist. Have them go through a full orthopedic and biomechanical assessment. Figure out what your strength deficits are, how you move, where your range of motion loss, your strength, and just sit down and talk with them. That's going to tell us a hell of a lot more, and you're going to get a lot more answers. And also, you can start usually on the first session. How we do PT is you're going to start getting hands-on treatment as well as exercise right on that first session. So you're going to start making progress right away. Okay. So see a physical therapist, have them do a full assessment, and get answers that way. If your physical therapist at the end of the session isn't quite sure, they will tell you, or they should. We do. We tell you like, hey, there's some stuff that we're not quite sure on. You should go see your physician to get a second opinion and make sure we're on the same page, or maybe get some imaging to back our thoughts process up. Okay. But 9 times out of 10, we can narrow down the diagnosis based on the orthopedic tests and measurements and biomechanical assessments that we do as physical therapists. So save yourself a whole hell of a lot money, time, and energy and frustration, and just go see a physical therapist, especially if you know you don't want to do injections, medications, or surgery. That's all that's left. Give it a shot and put yourself in a position to be successful. All right, thanks.